quick video on how to stretch the hip flexors, and especially the psoas, which we hear about a fair bit of the time. So you start in a kneeling position, 1 foot forward, everything at 90 degrees. So this one vertical, hip at 90 degrees, knee at 90 degrees. And then it's the classic one where you go into a lunge there. But the main element that's quite important, that makes a big difference, and I'm sure you'll notice it, is if you have a pelvic tuck before you start. So there are a few ways of thinking about this. So a patient of mine was telling me about doing a Michael Jackson, which seemed to talk to them, so that works well. Sometimes I'll place my hand on the patient's tummy and ask them to take their tummy off my hand, with that kind of going backwards, but really kind of doing this. And then I think in Pilates they use the image of zipping up a pair of trousers that's a little bit too tight and kind of getting the tummy in, and immediately the tailbone is also going to go down. So it's that kind of pelvic tuck. Anyway, so either both hands on your knee or one hand holding onto something, but basically this tuck is a really important element there. And then from there, this triangle doesn't change shape, so you don't go there, but you really keep it as one stable triangle, and as one stable unit, it'll shift forward. So, tuck, hands, and then stretch, and you'll feel the bite at the front of the hip. And it's even worth sometimes just going, well, what would happen if I didn't have the tuck? And then you can go on forever. And if you have the tuck, then you feel the stretch a whole lot quicker there. You probably want to hold this one for 15-20 seconds, and obviously use it on both sides. Otherwise, we'll have a few more asymmetries and compensations to deal with. But that's your hip flexor stretch, and mostly focused on the psoas muscle with this one.